Hello, hello, and welcome to today's podcast. Today, we need to talk about the midlife crisis. And we're not talking about the one where you buy a new sports car or you leave your marriage. What we are talking about is when your body stops cooperating, when you wake up one day and you don't recognize yourself anymore. Not because you're unhappy with your choices, but because your energy is gone, your weight is shifting, your sleep is disrupted, and your doctor says everything is normal. That kind of midlife crisis, the health crisis,
Right.
and it's real.
Yeah. So midlife crisis is the definition. If you look it up online, it's a period of intense psychological self-reflection and transition that typically occurs between the ages of 40 and 65. It's characterized by feelings of regret over unachieved goals, anxiety about aging or mortality, and the desire to make drastic lifestyle changes.
Okay.
So we want to kind of clear up the fact that maybe some of these feelings, maybe some of these ideas that are coming up or thoughts that people have are kind of more biologically driven. And maybe we need to understand a little bit more about really what's under the surface with this, and what some of the root causes of these things are. Not just the fact that, you're normal, it's part of aging. I cannot tell you how many patients that come in daily talking about it's all but just getting older. And, I don't even like saying that word. So that's the O word in the practice, and I don't like saying it. So it's certainly something that we can kind of explain that, well, there's other options. There's other ways. There's potentially ways that you can improve your own health and your own feelings and your own desires.
So, just talking about the biology of midlife, and these are all things that we have talked about in the past, and most of them we have. So, we have
Right.
other episodes that go into deep discussion or deeper discussion about these things, but we'll go through this just to kind of introduce these biological things that are going on during midlife. And so hormone decline is a major thing.
It's a very significant driver of a lot of these problems that people feel going through this crisis time, if you will. So, for women, obviously it's estrogen and progesterone are two big players. During perimenopause, it's significant fluctuations where, 1 minute you're great, 1 minute you're struggling, 1 minute you're having a lot of fun, the other minute you're crying. So there's a lot of variety, a lot of ups and downs in perimenopause.
Yes. And then obviously when menopause hits, then you have a drastic decline in estradiol, which is a big piece of the biological changer. Men suffer decline just like women do in testosterone, and that is a gradual decline though for men. So it's often missed because it's not as drastic. So it's a
very slow, subtle decline, right? I'm talking about 1% a year, starting at age 30, that testosterone will go down. And testosterone and estrogen are just as important in men as they are in women. I mean, there are 400 different functions in the body that estrogen has. It's significant. So it's not just reproduction for females. So
yeah, absolutely. And then the other piece that often gets missed when people think about hormones in midlife is thyroid.
Yeah. Thyroid function is something that significantly declines too sometimes and it's not necessarily that your thyroid level is low or off or dysregulated as much as sometimes it can be just a hypofunctioning effect of the thyroid itself. Don't forget, thyroid is a hormone that affects other cells in your body. And when those other cells are affected, then the hormone doesn't regulate that cell's activity well like it should.
Yeah. And growth hormone and DHEA are both in this hormone decline as well.
Yeah. And of course, cortisol regulation also begins to break down. So
the second thing is muscle loss. We've talked about that recently. Sarcopenia, this starts at age 30, and you just steadily have a decline in muscle.
Yeah. So the muscle itself becomes weaker. It looks different. If you could look at the difference, you can think of it as, you've got, a tenderloin with a nice thick muscle, and then you've got ribeye with the fatty part and the fibrous parts in there. So there's the difference from a visual standpoint if you're a visual person. So,
and muscle is your metabolic engine. It's going to help with glucose control. It helps to protect you when you're doing activities. And that's why that is important. And it plays a role in this biology that's going on during midlife.
Yeah. And you have to remember that less muscle means slower metabolism. And you're going to have more problems with insulin regulation, and you're going to have weight gain, weakness, and general frailty. And there are medications that individuals will take that can create and to exacerbate that sense of frailty also and muscle weakness. So that's also something of consideration.
And that kind of goes right into the metabolic shift with all of this, but blood sugar regulation and how our body handles fuel and
Yes.
does that process.
So the same diet that worked in your 30s is now causing weight gain. So it's that dysregulation that makes it a little bit more of a tricky thing.
Sleep dysregulation is huge. When you're not sleeping well, you're not recovering, you're not healing.
And then you have sleep apnea, which also is something that is significantly on the rise, which is contributed from a lot of different avenues, weight gain, but also just generalized anatomy. But that rise in sleep apnea is something that can be kind of sneaky and not really caught. Well, my partner's just snoring. Well, okay, I have to nudge them every once in a while when it feels like they're not breathing. So, but that affects your sleep. Your sleep affects a lot of different patterns and things with your production. So you're not producing growth hormone. And when you can't produce growth hormone, you can't repair your muscles and you can't regulate your metabolism as well either.
Fifth on the list is inflammation. And this is huge. You hear people talk about inflammaging recently, and that is essentially where this inflammation in your body just makes your body age faster.
Yeah. Yeah. So, and a lot of that's driven by visceral fat and, just general poor gut health. There's a lot of issues with gut health these days. Stress is also a big contributor. And of course, hormone decline. And we don't want to forget about the processed food and lack of movement. There's a lot of sedentary behavior out there that we try to force individuals to think about their movement activities throughout the day.
And I think you can't really talk about inflammation without talking about autoimmune disease, which is more prevalent now and probably diagnosed or caught.
Right. There's so many individuals that we see that we've identified different types of autoimmune processes that are occurring within them. And we identify that because you draw the labs, you're looking for it. And if you're not drawing those specialized labs, well, then you don't catch it. So.
And I think it's really important from a patient perspective. The types of things that we hear are, I used to sleep well. Now I can fall asleep easy, but I'm waking up in the middle of the night and I can't go back to sleep. Or, I just don't feel like myself. That's something that we hear quite often. A lot of people come in and they feel like, I don't have stress in my life. I don't have anything to be stressed about. They feel very blessed for the life that they have, and they don't understand why they feel this nervous system dysregulation. It's very, very common.
That's a good point. But, something to remember that this may be the beginnings of some of the metabolic changes, or maybe even the middle of it, but it's not the end. There are interventions that can be done to catch and change and correct this course of action for people.
So let's go into the emotional piece of midlife crisis, because that is there and it is
very real.
Very real. So identity crisis and loss of self. These people who don't feel like themselves, not only is it a biological thing, but there are a lot of things happening in midlife that create this identity crisis.
And women are very, very attuned to that and very, very aware of that. That, it's like, wow, things are just not quite what they used to be like. Men may notice it, but we can, they just kind of go on, or they maybe deal with it, or they chalk it up to just, well, it's part of getting older. So, but, typically.
There's that line. It's just getting older.
It is.
So during this time, things are changing. You've got kids that are leaving home. You've got aging parents. Things in our careers may be plateauing. So there's a lot going on from this identity crisis of our external world that's happening.
Right.
Another piece is that estrogen is so neuroprotective. And as it declines, it can really affect our emotions. Progesterone too, but this is a change that is very often so estrogen decline is very often related to feelings of apathy, which I think falls right in line with this,
Right.
identity crisis.
And, when it truly gets down to the low levels, women just feel like they're just not like themselves anymore. And it's, the brain is very receptive to estrogen. It's certainly thirsty and hungry for estrogen. And when you deprive it, that's when these types of feelings tend to start to show up a little bit more. And men experience this too, with the low testosterone levels. It's also linked to depression and kind of an inability to feel pleasure in some respects, and kind of a loss of drive and motivation and endurance.
Next, we'll talk about the stress biology loop. And stress is a real thing. And I think oftentimes this is a point where people can think that they're using stress as an excuse. All of these biological things that are happening. Oh, you're just stressed. Okay. And
Right.
how does this connect? Because it is all connected. So when you've got your adult children, your aging parents, financial stresses of paying for college and all of these things, those are stressful things and they are real.
Yes.
And what I hear very often is people feeling like they are not as equipped to manage that stress as they were previously.
And we're talking about chronic stress, not acute stress. There's a big difference here. Chronic stress is going to raise cortisol levels, which will suppress our sex hormones, and then it will start to break down muscle, and that will disrupt sleep and then start to drive this insulin resistance, which leads to a lot of the metabolic problems that we get into for people.
Yeah. And I think every conversation we have is just a reminder to me that everything is connected and intertwined, because you can't talk about one thing without also talking about the trickle down effect of everything else.
Yeah. And then, of course, all this biology can drive behavior. So now you're talking about impulsive decisions, career changes, moves, geographic moves. These are just things that are somewhat of a meaning and anything for meaning and purpose. But what about hormonally depleted brain is just desperately looking for something? Well, is it estrogen? Is it dopamine? So,
oh yeah, now you're going to bring dopamine to the picture, which is a whole nother thing, considering technology that's in our life now that is another new thing.
Right. Exactly. So, but not every midlife crisis is pathological. It's worth asking, to find out what's going on, or there biological changes, things that I can do, things that I can fix, correct, add to correct. And it may not be necessarily taking a supplement or taking a hormone replacement. It could be just simply lifestyle changes. So,
yes. And I think that it's really important to know that there is no one size fits all answer.
Yeah. And then we're talking, then that brings up the whole thing too, is what about gray divorce? We've heard that before. These are the surges in divorces that are occurring, in 50 plus year old individuals. So it's something that's doubled since 1999 or 1990 actually is when it doubled. So, is it part of an empty nest growing apart, finding yourself, what are we looking at?
There's actually a lot of evidence that shows that there are many reasons that this is happening.
Right.
Longer life expectancy, more financial independence. People don't feel like they have to stay married because there's more financial flexibility. A whole list of reasons that they've talked about this gray divorce. And that conversation really started in 2004, I think. And then since the most recent uptick in all of the conversation around perimenopause and menopause, they're looking at how this might be tied together. And one of the things that we really haven't touched too much on, I mean, a little bit, for women, and I would assume men too, but I'm going to speak from the women's perspective. during this time of all this changing hormones, there is more irritability. There is less filter. That is something that, that kind of ties into the apathy thing with estrogen. Like and there are good things about this not caring what people think. Like that's not all bad. But when we have increased irritability, a feeling of not caring, this apathy, all of these things, it can set us up to be less tolerant of those around us,
Right.
which can absolutely.
Because when you're exhausted, you're irritable, you're disconnected from your body, and your libido is gone, intimacy is going to start to suffer. Communication suffers and patience begins to suffer. So all that starts to boil over.
And I do want to just reiterate, I'm speaking from the female perspective, but I believe that the men are going through all of this too. So not only it's both parties that are less tolerant and more irritable, all of those things. So it is going to take some work and some questioning to kind of get to the bottom of what is really playing the biggest role. So to be clear, we're not saying that optimizing your hormones will fix your marriage or make you love your job. But what we are saying is that when your brain and body are working, you can make more clear decisions about your life. And when they're not, things can feel impossible.
Yeah, impossible, uncertain, for sure.
So I think the next thing that comes in is why does conventional medicine miss these things? And there are several reasons.
Yes, but the real problem, I think, really kind of to boil it down to 3 words: normal isn't optimal. Maybe 4, but the optimal levels is where we want to be. We don't want to be in the normal range. If you look at the way that reference labs have their readings, we talk about this a lot. We've talked about this in other podcasts, but with these reference range normals, this is an average range of the population. And what people don't understand is that 93% of these people are metabolically unhealthy. And so now what we do is we have a group of people where, do you want to compare yourself to 95% of the people that are not healthy, or do you want to be more optimal? So normal's not always the best.
Right. So when you go to your primary care doctor, they are most typically looking at normal ranges. They are not looking at what would be optimal for you. And that is just the way that model is set up. They are looking for disease, not for trends that show suboptimal function.
Right. From a biological standpoint. So, testosterone levels drop, TSH levels start to rise, some people. And so, maybe it's normal for age, but do you want to feel old or do you want to feel younger? So there's a difference there.
I think the next thing is that we hear a lot of times that people feel dismissed or feel like they aren't heard in their discussions with their primary care. And I think that we can excuse a lot of things as it's just stress. It's just aging. It's, we can excuse a lot of things. And that's where that dismissal comes in.
Right. And men with low testosterone, you're just told to exercise more and lose weight. Okay, well, that's one option, and that I can't disagree with those things, but there's kind of more to it. There's more under the surface there that brings us up.
And again, that goes back to normal isn't optimal, because when you're operating from the lens of we need to fall in the normal range, if you're in the normal range, then it must be aging or it must be stress.
Right.
It must be these other things because we're normal. Well, that's where you have to kind of flip the script.
And, when you hear a lot too about, okay, I'm having fatigue and weight gain and brain fog and low libido. And is that just, it's not part of our character. That is certainly something that's potential. Yes. But there are biological reasons for some of these things. And so that's where you can start to dig a little deeper and try to find out more of a true cause.
And I think that leads into the next section, which is the 7-minute appointment blocks that we have in traditional medicine. It really does take more time.
Yeah.
You have to take the time to dig in and really hear about what's going so that you can start to connect the dots.
Right. Because most doctors will have about 7 to 15 minutes, some studies show to kind of diagnose a patient and write the prescriptions or give them a plan and then move on to the next patient. And that's fatiguing from a physician's and from a provider standpoint. That could be very fatiguing, but it's also not very pleasant to have to be sitting in the chair trying to get your point across and know that your doctor is just wanting to hurry up and write you a prescription and get out to the door to the next room. So
yes, and I always like to just give the caveat that we are not saying that there are bad providers out there, like that this makes a provider bad. But we are saying that that provider is set up in a system that is meant to treat acute illness and
diagnose it,
maintain.
Right.
And
We're talking about treating a disease process after it's already been there, it's already occurred, not a preventive process necessarily sometimes.
Right. And this kind of leads to the next thing of the difference between testing and looking for when you are we're in a prevention mindset, you're taking extensive tests. At your primary care, you're getting a very pared down,
very focused, insurance-driven testing that, there's diagnosis codes that go with that. So this is the test that can be done. Whereas in a lot of some of the other more specific, maybe inflammatory tests or hormone level tests, they may not be covered with insurance. So they may not be covered and paid. So.
Right. So when you're not testing, you can't diagnose. And for instance, in this is thyroid antibodies. This is one that very infrequently is tested, but could diagnose a thyroid issue way earlier in the process.
Right. Yeah.
And then lastly, from a conventional medicine standpoint, is fear of hormones. And
especially for women.
Yeah.
Yeah. Because the WHI Women's Health Initiative of 2002, I mean, it literally scared a whole generation of females away from hormone replacement therapy. And we're not saying that, that there are a lot of other options that are out there, but to have as many choices as you can have to make an informed, appropriate decision for yourself, you need to have that available.
Right. And so not only are women scared in general, or not scared, I would say have this misunderstanding of hormones, there's a whole generation of doctors who also have this misunderstanding.
Right.
And so that can be a struggle. I don't know how many times we've talked to people who have gone to their primary care, asked for the testing, and were told that they couldn't get it or there wasn't a reason for it.
But yeah, that study was flawed, and the reportings from it were not appropriately provided or looked at. And then that's subsequently is created a lot of the fear with that. And you kind of also have to understand that bioidentical hormones are not the same as synthetic hormones. There's differences, and there's plenty of studies out there to look at bioidentical hormone replacement and its benefits. And nobody needs to be scared about the big C word, cancer, necessarily, also with blood clots and things like that. So there's options. And if you have the information, you can make those decisions from an informed standpoint.
So what is a good midlife reset, or how do you tackle this?
Right.
And I think that the biggest part in our practice is the reveal is the biggest first step, revealing where you're at.
Which takes a couple of hours.
Mm-hmm.
So,
and an extensive, or comprehensive lab panel to look at metabolic markers with a deep dive thyroid markers with a deep dive, inflammatory markers, micronutrient markers, and autoimmune, and your sex hormones in full.
Right. So, I mean, there's a lot of things, and, we could touch on those briefly, but, the sex hormones are the estradiol, progesterone, the testosterone, and not just total, but a free, and then there's DHEA-S, cortisol levels.
And your metabolic panel, the things to look for in addition to your regular metabolic tests that they would run would be a fasting insulin, an A1C, getting your lipid panel with the addition of an ApoB, potentially an
LP level, and then also determining HOMA-IR, which is an insulin resistant of calculation that we also use. So, and then looking at thyroid panels, not only just a TSH, but free T3s and free T4s with the antibodies, the thyroid antibodies.
And from an inflammation standpoint, we want to look at the CRP. We want to look at homocysteine.
Right. Vitamin D, B12, and even an iron panel. Those are very important too.
For micronutrients.
Yeah. And then we go into lifestyle changes and things that we look at. So what's the body composition? We really, obviously DEXA scan is kind of the gold standard for looking at body composition, but not everybody's got access to those. Those are pretty cheap. It does have a little bit of radiation exposure, but there's a lot of ways looking at body composition without having to take the time to go get a DEXA scan. Because honestly, if it's not convenient, it's going to be real difficult to get that. And to monitor it is the key too. So we use bioelectrical impedance, which is a real good way to kind of follow body composition along, because it's important to know where you're at. And as you go forward in your treatment or your plan or your improvement in your midlife, maybe it tells us where we're at, but where we're going. We look at the trend. The trend is the more important thing to see. How much success am I doing in my program?
And sleep is a big assessment that happens in the reveal section of our care, and taking a deep dive into sleep and, screening for sleep apnea when it's indicated.
Right. And then we got the Rebalance part of our health assessment, which, basically one starting off the top is, optimizing hormones. That's an important thing to know, that there are levels that need to be where they need to be to feel good. It's not about, I want to be normal for your age. Well, you got to remember, normal is not optimal. And so, if you want to feel better, sometimes you need to have levels where they need to be, to not only from a symptom relief, but also from a prevention and improvement and avoidance issues, from avoidance of chronic disease later in life too.
Yeah, absolutely. And just to note that replacement isn't the only thing. Like, there are a lot of things that we can do to improve our normal natural hormone production without having to go down the road of actual hormone replacement, if that's what you choose.
Right.
Movement and building that muscle. That's another big piece of Rebalance. And it's getting that baked into our routines, because muscle is just so important.
It's part of metabolic health. If we don't do anything, you're losing your metabolic health. It slowly declines. We want to get that protein intake around 0.8 to 1 gram per pound of ideal body weight daily. That's a significant number. That's a lot of protein, so, and then, another pillar is, well, let's try to fix our metabolism. We need to address our insulin resistance. And, we do that by reducing that ultra processed food and prioritizing our protein and fiber intake. We want to get that fiber up 25 to 35 grams of fiber a day, depending, for men and women for that matter. So women need less than men.
And this is another example of how these things coincide, because increasing your muscle is also going to help with your metabolism too. And then protecting your sleep. So we talked about assessing and knowing where your sleep is, but then also protecting your sleep. So what do we have to do to get sleep optimized, whether it be treating sleep apnea or, changing our sleep hygiene? Lots of things that can be done to improve sleep.
Right. And stress is a big input in that.
Absolutely. So Revive is building the long game. And this is going to include some of those things that we've already talked about in Rebalance, but then also add in relationships and community, and setting yourself up to be able to go through this process and
Supported.
maintain, support it.
Right. And it's a transition time. So, work on our attitudes and our just helping us through these types of things that need to be done. Sometimes you need therapy, coaching, spiritual help, just something to help you navigate through it sometimes.
Yeah. And that we see as so beneficial.
Mm-hmm. And retesting is often we try to stay ahead of it. I mean, it's good to retest on an annual basis.
Certainly annually.
Some things we do 6 months too, and sometimes it's more often depending upon how bad something may be and how important it is for that person actually in their goal.
And your symptoms are going to dictate that too.
And you want to kind of build your team. Yes, you've got to have a healthcare provider, but it's also something to have a functional healthcare provider, trainer, the right community associations, or a therapist.
Mental health, counseling. Yeah. So that's kind of it in a nutshell.
Yeah. So, but it's a big nutshell. But it's certainly something that as the people drive off being motivated, and if you see the weight come off, or if you start to feel better, or you start to have a better outlook, or maybe you have a better understanding that no, I see that I'm going down this road of depression here now, and what can I do differently? How can I change things up? But if people can have that benefit of feeling more motivated and feeling and seeing the results, then they're a little more able to kind of continue on down that path, because it's a process. It's not something that can happen quickly. Just like we tell a lot of patients, hormone replacement therapy is not drive-through medicine. It's a process. It takes a while. And, you have to understand that your body took a while to get where it is, and it's going to take a while to get back. But it is something that's certainly achievable. And, one thing you really have to know is that you need to be heard. And it is certainly, you are certainly a worthy person to be listened to. And it's certainly, if you don't get answers, if you don't get what you feel like you need to have, then you need to keep looking.
Yes.
So,
yeah. And the other thing I'll say, as we just kind of wrap this up, started out with midlife health crisis, looking at both of those things and just knowing that everything is connected. So if you are having what feels like a mental health crisis, you might also start asking the questions, how is my biology playing into this too? And vice versa. If you're having issues there, maybe we got to ask, how is my mental health playing into this, my physical
right.
health?
And it's not just one thing. It can be a multitude of things. There's a lot of spokes on a wheel. And, if those spokes aren't the right length, then the wheel's not going to turn well. And so you kind of have to kind of keep looking.
Yeah. Thanks for tuning in. We really appreciate you sharing your time with us. And if we can help out in any way, please reach out. And until next time, have a healthy day.